lung cancer incidents are expected to rise by around 5 to 7 times in the next couple of years. We know tobacco is a reason for that. But how much of a reason is, say, air pollution?
Huge. I think in India, we are realizing that 50% of a particular type of, the commonest type of lung cancer, 50% of that type is actually driver mutation driven, which means it's a non-smoker's cancer, which means that there is an insult happening to the human body from somewhere that is leading to this cancer causation or cancerous changes in the body. And if you look at the recent data that was presented at ESMO 2023 by a group of researchers in the UK, it showed that a particulate matter of 2.5 micron in size and over that size was actually directly responsible for a particular type of non-smokers lung cancer called EGFR positive lung cancer, which is seen in nearly 25% of adenocarcinomas of lung in India. So if you look at that, and yes, it is a single major study and it needs to be duplicated and all of that. But if you really see the amount of pollution we are all facing on a day-to-day basis, and just to give you a context, 2.5 micron, the regular size of the particulate matter that we face every day is 10 micron. So if you have that kind of exposure happening, even if you're a non-smoker, every day you are being exposed right from birth to levels of injury that are like smoking cigarettes, even as you grow as a child. So you are seeing younger lung cancers, you are seeing lung cancers in non-smokers, and it is almost going to be an epidemic. If you look at the numbers, it's going to be an epidemic. So it's high time we figured out prevention strategies, not only for smokers, but also for non-smokers. And when we talk about air pollution, we talk about going out and, running in nature. And when I tell my patients, I'm thinking about all the pollution that is out there on the bridge when they go for their morning run. So we have to be very mindful of all that and really also be mindful of the smog level and when to expose yourself to that kind of injury as we go along in our routine lives, and to be aware and screen.
Okay. Lots of younger people are also getting cancer. One of the reasons, as Dr. Rajappa had earlier told me before the show began, is because of the population, and we have a younger size of population. So that could be one of the reasons. But is there a susceptibility also that India has, which is resulting in younger people getting cancer? You mentioned air pollution, younger people come with incidence of lung cancer. Could that be correlated?
Ekta, we are largely deficient as a country in understanding the epidemiological transition of cancer. We are really deficient in studying what are the epidemiological factors contributing to younger presentation of cancer. We are doing a lot of work in this area, but we are still largely deficient. If you look at lung cancers, I gave you a reason. But there may be similar reasons for breast cancer happening in younger population, non-hormone positive breast cancers happening in a younger population. Triple negative breast cancer in India happens at least 10 years younger, in 10 years younger women than what you see in the West. So a lot of this, I believe, is coming as a contribution from pollution. But which pollution? What pollution are we talking about? What is the exact cause? We haven't nailed it yet, and there's much work that is required in this area.
The other thing is, when it comes to cancer in India, is the low survival rates. It stands at around 30% of India's cancer patients survive for over 5 years, and almost 50% of cancer is seen in late stages in India. Is that primarily because of a late diagnosis?
I would say yes, primarily yes, because we have such poor screening rates. We have complete lack of awareness. We have extremely poor screening rates. We as a nation don't screen. And I'm not talking about screening of the poor. When we talk about screening, we talk about these vans where we are running camps and we are bringing in people for free screening. I'm talking about screening of regular people. Just think around yourself. Each one of us, 3 of us are here right now. Think around yourself. Is your family screening? Are your friends screening? We as a nation just don't screen. So we end up with late diagnosis. We end up with more advanced diseases, and we know that advanced diseases are linked with death and dying.
For more news and updates, all you need to do is follow CNBC TV18 on all of our digital platforms.